A very good evening all. I'm Aditi Lamba with the Wednesday night edition of South Asian News. Welcome to Vision of Asia, voice of our community. We are coming to you from our studio located here in New York City. Hope you're all doing well and also taking care of yourself. Here's what's happening all across. More than 9.3 million cases of the coronavirus have been confirmed worldwide, with at least 479,000 deaths globally since China reported its first case in December of last year. Today, the World Health Organization said that they expect the number of the novel coronavirus to reach 10 million next week, quite a sobering number. In the United States, 26 states are seeing spikes in new COVID-19 cases, while reopening continues in the nation, which includes states such as Florida, Arizona, Texas, Washington, California, and others. Top health official Dr. Anthony Fauci has said that the next couple of weeks are going to be critical in our ability to address those surges of cases, and made a plea to all Americans, saying, Plan A, don't go in a crowd. Plan B, if you do, make sure to wear a mask. We'd like to remind all to continue practicing social distancing. We are still in a pandemic, and keep up with the guidelines of the U.S. Center for Disease Control and Prevention, the CDC. And on the nationwide protests, on the ongoing Black Lives Matter demonstrations continue to demand an answer to systemic racism in America and a call for police reform. It's been nearly a month since George Floyd's death in Minneapolis. Senator Kamala Harris said that she thinks the country needs to reimagine public safety and direct funds to underserved communities. Much on the impact of these demonstrations and their demands on the show tonight, along with COVID-19 updates and measures with top South Asian medical professionals. Do connect with us if you are on the front line during this pandemic or in an organization working towards racial justice and immigrant rights. Write to us on events@itvgold.com. Let's now begin tonight's episode taking a look at the headlines. ACLU New Jersey on systemic racism, Supreme Court's DACA ruling and COVID-19, featuring Director Amol Sinha. Dr. Lieutenant Colonel Kalsi on COVID-19 updates, reopening and measures, New Jersey. Swami Mukundananda addresses South Asian community on International Festival of Yoga, JKYog. It's time for a short break on Vision of Asia, voice of the community. We'll be right back. Welcome back. I'm Aditi Lamba and this is Vision of Asia Wednesday night episode. Let's begin the episode taking a look at the latest in coronavirus pandemic. More than 9.3 million cases in the world. Today, the total number of cases in the United States surpassed 2.4 million, with at least 121,000 deaths. This is happening while the nation all across continues to see various phases of reopening. Here in the tri-state, New York, New Jersey, and Connecticut, today all the governors of 3 states announced that the tri-state will require travelers from states with high COVID-19 cases to quarantine for 2 weeks, addressing the spike in cases seen in 26 U.S. states. Florida is grappling with the surge of new cases and hospitalizations, with now markings of the next large epicenter of coronavirus transmission. Bringing much perspective on all this and more on the importance of social distancing and wearing masks, we spoke to Lieutenant Colonel Kalsi, expert in emergency medicine and on the front line at the ER. Dr. Lieutenant Colonel Kalsi provided much insight into the impact of COVID-19 and important measures for all to consider with reopening.
When we talked about hydroxychloroquine earlier,
Yeah.
There were a lot of sort of mixed messages about whether or not that would pan out as a good treatment or not. I think most of us now understand, given the body of literature that's out there now, that hydroxychloroquine does not seem to work. There was a very, very good study done by the VA that shows that it can cause arrhythmias and other complications, but it doesn't really actually help anybody with COVID infection. So I think hydroxychloroquine as a treatment of choice or an agent of treatment is
Right.
out, but there's a few other medications that are being looked at, and I think the research there is still sort of ongoing. So I can't really comment on that, but right now, really the only weapon we have in our arsenal against this is social distancing and quarantine. It's worked in previous epidemics, and it's worked now too. To a lesser degree. We just have to come together as a community and wear masks, not just for ourselves but for other people. When you get into a car,
Yeah.
there is an expectation that you're gonna wear a seatbelt. And that there's that same expectation. If you're out in public, you should be wearing a mask because it is the socially appropriate thing to do. This is not political. This is just science.
Definitely, it is science, and that is why it's so important to understand what is happening. I want to reflect upon reopening because we have a lot of questions here that have come to ITV Gold as well. Do you medically suggest reopening is a smart idea? And when we're looking at reopening, is it safe for public to go into places such as the subway, the restaurants, salons, stores, and others? We're trying to figure out what is, a safety precautionary measure here.
Yeah, again, I think it goes back to each state, and depending on uh, what their levels of infection are. In areas where they have not seen any cases, sort of like, let's say, rural parts of the Midwest where they don't have a ton of cases, I think you could probably start to reopen a lot of those public areas safely. But it's going to take an individual personalized approach for each of those areas. And I think it can be done responsibly, and I think it should be done. But mass gatherings are very, very problematic. So if you're going to say, "Hey, I'm going to do a a 10,000 person indoor rally," I think that's a big mistake. Because that's a very, very high possibility of passing infection to the other people there, and that the same goes for large indoor parties, where you're going to have a few hundred people in an enclosed area. The
Yeah.
likelihood of transmission in those types of spaces is much, much higher than if you were to just open up a restaurant for uh, outdoor seating, for example.
So, but when you're looking at states, and I want to discuss some of these states with you real quick here. When we're looking at the states of New Jersey or New York, who have really sort of now contained the virus and are reopening, would you suggest people to go out and go to these outdoor dining experiences outside the restaurants, or would you still suggest that people stay inside as much as possible?
So I'll talk a little bit about Jersey because that's where I live. I think if you go to Hoboken, where my buddy Mayor Ravi Balla is sort of leading the charge, they've opened up all these extra seating areas outside all of the restaurants, and I feel we can do that safely. When I go there, I don't feel like I'm at risk, because I think they've done it responsibly. Um, now, so I think Governor Murphy, Attorney General Gurwal, they've all sort of taken charge of the situation, and I think in certain parts of southern New Jersey, there were areas that started to open up a little too quickly and too aggressively. And in the public's interest, they stepped in and they said, look, this is too much too soon. So I think it's important to have good oversight to make sure that we do this safely and properly. And I think that these guys, I think that the individual governors that are charged with taking care of the public's health should come up with a solution for each of their states. The other question I get a lot by patients is, these COVID antibody tests that are out there now, and as well as the, so you have the COVID nasal swab tests, which, go in pretty deep. And then you have the blood antibody tests. And I think there's a lot of sort of misunderstanding about the two. So the nasal swab, and so I think it might be valuable just to talk about that really quickly.
Let's do it.
So the nasal swab, the COVID nasal swabs, it's a deep swab. I mean, so it's going into your nose like that much, a good 3 inches into your nasal cavity, and where we take a swab out of each side, and we send that off for testing. Typically, it's going to take at least a couple of days in order to get that result back. But that nasal swab COVID test tells you whether or not you have the coronavirus right now, as of the moment that they, that the swab was taken.
Right.
The blood test, the antibody test, tells you if you've been exposed to the coronavirus over the last 3 or 4 months, maybe even 5 months. Because what happens is you get the coronavirus infection, and your body will rapidly start to produce these antibodies. But it's not going to produce these antibodies necessarily right away. People sometimes, their immune systems will kick in after a few days, maybe a week, maybe 2 weeks. It's sort of different for everybody. So that's why the antibody test is better at telling you whether or not you've been exposed over the last, several months. But now, if you get the antibody test and it's positive, what does that mean? We're, even as medical professionals, we're sort of struggling with that question right now. We don't know if you have antibodies, which I do. I had acquired the COVID infection a couple of months back.
Oh, wow.
And and I didn't have a cough or anything. I just had some mild shortness of breath, fever, and body aches. So the types of symptoms that you get there's a huge variety of those. So my antibody test came back positive. I don't know if that means that I'm more protected, but we think that if you have antibodies, it should mean that you should not be able to get reinfected, at least in the short term. Now, we don't know if this translates into anything long-term yet. Right. The virus is constantly mutating and changing, like everything around us. So, 4, 5, 6 months from now, maybe during this, the second wave that hits us this fall, will we still be protected? I don't know. That's a big question for all of us.
A positive story, June 21st saw the celebration of the International Day of Yoga, an annual event promoted by the United Nations that spreads awareness about importance and the effects of yoga on health and well-being. This year saw the theme Yoga for Health, Yoga at Home, accounting for social distancing measures during the pandemic. On that, tonight we have a motivational message from Swami Mukundananda, a renowned spiritual leader who spoke on the importance of faith, peace, and positivity during the pandemic. Talking about holistic and united attitude to life, he urged all to join in the ongoing virtual celebration produced by JKYog, the 2020 International Festival of Yoga. JKYog is a nonprofit dedicated to physical, mental, and spiritual well-being of all with an authentic knowledge of yoga for the mind, body, and soul. Here is a message by Swami Mukundananda for ITV Gold viewers.
Divine souls, how amazing and insuppressible is the human spirit that in a situation where there is a pandemic around the world, we still have the positivity, the faith that this crisis is temporary. The world is not only going to survive it, but come out the better from it in the year 2015. Along with the rest of the world, JKYog began the celebration of the Dallas Yoga Fest over the years that grew into a huge wellness event and festival. So interestingly, this pandemic has not knocked us down. It has just taken yoga to every household. And today, we are now in the 6th year of the celebration, having an international festival of yoga. If we wish to battle this coronavirus situation all together, all united, as one humanity, we have to stand up to it. So this beautiful art and science and philosophy of life, which we call yoga, teaches us a holistic and united attitude to life.
It's time for the short break. Stay with some Vision of Asia, Voice of the Community. We'll be right back. Welcome back. This is Vision of Asia, Voice of the Community, and I am Aditi Lamba. This is the South Asian news segment, and we continue to follow the ongoing discussions on race and racial justice in America. We have now another segment featuring Executive Director for the ACLU New Jersey, Amol Sinha, who joined us for a virtual conversation discussing much on racism, DACA Supreme Court's ruling, and the ongoing COVID-19 relief projects of the ACLU in New Jersey. The American Civil Liberties Union is the leading national organization dedicated to defending as well as extending civil liberties for all people in the country, working tirelessly towards protecting immigrant rights. Currently, during this pandemic, the ACLU of New Jersey is monitoring to make sure that government actions reflect public health and scientific evidence, not fear, making sure that the rights of most vulnerable remain intact. Here is Amol Sinha, the Executive Director for ACLU New Jersey.
You know, it's really important to do whatever we can to make sure that we create as welcoming of an environment as possible for immigrant communities. You know, under the Trump administration, we have seen chaos when it comes to immigrants' rights, right? He's not just targeting people who are undocumented, he's going after visa holders and people who are coming here through what he would call the proper channels. And I think it's really important that the Supreme Court upheld this decision that says that no, you know, dreamers and people who qualified for DACA are American and they deserve an opportunity to stay in this country and deserve to be protected with work authorization. I do think that it's not enough. We of course care deeply that the Supreme Court said this. But we need to take proactive steps to roll back all of the harm that the Trump administration has incurred across this country on immigrants' rights. we need to make sure that we're taking steps at the state level to protect immigrants here as well. I think you see the stories of children in cages. You see the stories of people being deported in record numbers. You see the stories of hate crimes against immigrant communities over and over and over again. That's sort of a top-down perpetuation of fear and hate that the Trump administration has engaged in. Now, the previous administration under the Obama era, Obama deported more people in this country than any other president before him. And that's an important statistic to remember, that immigrants' rights were under threat under Obama as well. But I think the redeeming factor was that he was taking steps to create pathways to work authorization through DACA. Under the Trump administration, what we're seeing is total chaos, where anybody could be targeted at any time. There doesn't seem to be any rhyme or reason to it. It includes South Asians. It includes people who are Indian and from other backgrounds. If one of us is at risk, we're all at risk. And I think it's really important for all of us to speak out.
Amol, in terms of DACA, what according to you is going to be the future of these children? A lot of them are, they're adults now and they're working as well. They're on visas. How is that going to, or on a work permit actually, how is that going to sort of translate later on?
Yeah, not only are they on work permits, they are people that have children here who are U.S. citizens, right? DACA recipients have jobs as teachers and as nurses and as doctors in our country, and we can't afford as a society to try to remove all of them or create an environment where they're no longer welcome or unsafe. I think it's really important to the moral fabric of our society and the economic fabric of our society to make sure that we're as welcoming as possible. I hope the future holds good things for them. I hope what we see is a pathway towards permanent work authorization and permanent residency and perhaps even citizenship in the United States. And that's really important because, look, we're not going to, there's no way that we, through any legal process, we'd be able to get rid of, all 12 million undocumented people in the United States, or even the 700,000 DACA recipients in the United States. I think it's incredibly important that we try to create as meaningful and as welcoming of an environment as possible for all people in this country, and make sure that they're treated as American, because what we're going to see otherwise is a further increase in hate crimes against immigrant communities. We'll see a further increase in deportations, and we'll see a loss to our economy as a whole. And I think that's really important for us to acknowledge that it's not just racial justice, it's not just immigrants' rights, it's economic justice as well.
Yeah, and I think it's so important for organizations such as the ACLU to stand for these immigrants and to ensure that they have their right and their liberties to themselves, and that they are able to live a life. Just while we're still in this interview, I wanted to sort of reflect on the COVID-19 relief efforts and all of the programs that are currently running under the ACLU. If someone wanted to get help or, they were under distress, I would love for them to be able to reach out to your team and, get their voices heard.
Yeah, the work that we're doing at the ACLU is incredibly meaningful, and I feel it's incredibly urgent under COVID-19. In this moment of COVID-19, our role we see as trying to protect the most vulnerable, and that includes people who are incarcerated. What that means is, jails and prisons in the United States are hotbeds for disease and virus, even in good times. And right now, what we're seeing is that they are the centers of virus concentration all across the United States. And in New Jersey, where I am, it's the death rate is the highest in the country related to COVID-19 in prisons. And that's really, really unfortunate. And it's something that was preventable. It's something, look, in New Jersey, we have more deaths related to COVID-19 in prison than New York and Massachusetts and Pennsylvania and Connecticut combined. And that's really heartbreaking. So we're taking steps to protect people. All public health experts and criminal justice experts agree that the best way to protect people in this moment is to allow people to leave prison and be properly self-isolated. And also that not only creates opportunities for them, it also creates people, it creates opportunity for people who are left behind in prison to properly self-isolate and socially distance, because prisons are not designed for social distancing, right? They're designed to warehouse people. And we have the ability right now to take steps to cure this problem and make sure that we don't see a resurgence of the disease because of inaction in our prisons. I think it's really important to note that even when things feel safe for us in the United States outside of prison in the world, the virus will continue to rage on in prison, and that's going to impact people who are incarcerated. Of course, it's going to impact people who are working in prisons, and it's going to impact their family members and anybody else that they touch. And we'll never truly be able to eradicate the virus until we address the conditions in our prisons. So we're working on one thing that's a pandemic-related health credit, so that if people are incarcerated during a public health emergency, they will get credit for the time served so that their sentences are reduced. The goal there is that in New Jersey and all across the country, there are thousands, if not hundreds of thousands of people that are going to be released anyways in the next several months. Why should we allow them to expose themselves to the disease and bring that back into communities if we can take steps right now to release them and have them properly self-isolate and quarantine so that they don't further expose the disease to anybody else?
And that is all for tonight's show. Remember to send us your suggestions and get your voices and organizations on our show. Email us on events@itvgold.com or follow us on Facebook @itvgold. You can also now subscribe to our YouTube channel to watch many of our popular shows for free. Thank you for joining us tonight from Queens, New York. This is Vision of Asia, and I am Aditi Lamba. Take care and please stay well.